Well, good morning. Good morning, everybody. I'm excited to be here to give everyone an update on how we are helping our cities and our counties across the state of Oklahoma in their fight against COVID-19. So I'm joined today by Pittsburgh County Commissioner Charlie Rogers, Comanche County Commissioner Alvin Cargill, Payne County Commissioner Chris Redding, Edmond Mayor Dan O'Neill, Lawton Mayor Stan Booker, McAllister Mayor John Brown, and their City Manager Pete Stasic, and Woodward City Council Member Roscoe Hill. So thank you guys so much for being here and what you do for Oklahoma and your communities. So the state has received $1.2 billion from the U.S. Treasury thanks to the confidence, the foresight of the Oklahoma congressional delegation and President Trump. This money was provided through the CARES Act Coronavirus Relief Fund, and the state has set up a thorough process to reimburse state agencies, cities, and counties for expenses incurred because of COVID-19. I started this process by forming the CARES Forward team, a group of dedicated public employees and cabinet secretaries with a history of financial, accounting, and audit expertise. They quickly got to work on a platform to efficiently and effectively get money out the door. And I am proud to stand here today to announce that we have developed a system that is already garnering national attention from our peers in other states of how we're distributing and set this process up. Thanks to this process, within 10 days of receiving the requests from these cities and counties, we have already approved 30% of them, and we're set to deliver the rest of these by the end of this month. 67 cities and counties have requested reimbursement so far for COVID-19 related expenses, totaling $7.5 million. Some of the awards we are announcing today include $1.25 million to the city of McAllister, $160,000 to Comanche County, roughly $100,000 to the city of Lawton, and roughly $57,000 to Payne County. The state is committed to helping all of our local governments navigate and reimburse them for all COVID-related expenses. We're also working with cities and counties on how to invest in public health and safety measures and help them digitally transform the way they deliver services while we keep confronting the presence of COVID-19. I want to thank you to my friends that are here today. Appreciate you, to the other mayors and the county commissioners. Please note that we will begin also receiving new requests on July 1st. So get your account set up so all the other cities, the county commissioners, can get their account set up at governor.ok.gov/CRF grants. So help is on the way. Get your reimbursements in starting on July 1st. Now I'd like to introduce the Mayor of Lawton, Mayor Booker, to share a few words about how this process went. So Mayor Booker.
All right, thank you, Governor. It's an honor to be here today, and we appreciate the partnership that we have with the state. It seems like it was just a few weeks ago I was here for the announcement of this, and at that time you promised, Governor, that it would be an easy process, an efficient process, and you've lived up to your promise, and I appreciate that. Just a few short weeks ago. This is really helping us as a city because there's so much uncertainty in city finance today, and while this won't take care of our shortfalls, it takes care of some of those expenses that have happened that would not have happened had it not been for COVID. Obviously, the virus is going to continue to be with us until a vaccine is found, and we look forward to partnering with the state going forward, finding ways to work through this process and work through medical issues and testing as we go forward. And also, it's important in Lawton that we continue to work with our rural health system to help build that up and meet the needs of rural America, rural Oklahoma, and also the infrastructure that's needed as we rebuild our economy. So, Governor, thank you for keeping your word. Thank you for making it easy, and thank you for having us here today. And with that, I'll introduce my colleague from Comanche County, Commissioner Alvin Cargo.
Thank you, Governor and Mayor. I'd like to thank the state for, we contacted COVID-19 in our jail, and we were struggling, and the state did a great job. They sent resources down for us to minimize the impact that we were seeing within the jail. They sent the Department of Corrections, the Department of Health down, and their rapid deployment curbed the spread of the virus within the jail. And the state's partnership's been great through this process. Their consistent and strong help has helped us get past this. We're not there yet, but we're on the downhill slope, and I just want to thank the governor and the state for being very generous and very easy to work with, and pushing this and making it a simple process. And I'd like to now introduce my colleague, Payne County Commissioner Chris Redding.
Thank you, and thank you for the opportunity to be here today, Governor. We greatly appreciate the efforts that Governor Stitt has made to make this process incredibly easy and incredibly quick. The speed of it defies government in many ways. Usually we make fun of things moving at the speed of government. Now we have to be kind of careful to see who's behind us, because if the governor's office is coming behind us, we need to kind of maybe get out of the way when we say that. But during this process, we've been able to do a number of things that have made the Payne County a lot safer. One of it, we've shifted the employees to telecommuting or teleworking, and made most of our processes in county government electronic. You can do almost everything now except show up in court from your computer. We've sanitized public gathering areas and communal areas on a 3 to 4 times a day, depending on how much traffic we have. But I think more importantly, we've been able to purchase protective gear for the sheriff's deputies and for the detention officers, and we've been able to keep the public safe, the deputies safe, and the jail pretty much COVID-free until just yesterday. And we're starting testing on that now. But we're going to continue to be vigilant in our efforts to keep COVID at bay, and the money that we're getting back in is going to help maintain that ahead of the curve kind of attitude that we've been able to maintain in Payne County. It's only been recently that we've had a significant number of cases, and that's with the students coming back in and bringing it with them. But we're also in the process of keeping that to a minimum as well, as we stay on top of these things. This money is a blessing, and we thank you so much for making it so fast and easy to get. Thank you. At this time, I'll introduce my colleague, McAllister Mayor John Brown. John?
Morning. First of all, I want to start out by thanking the governor and his team for moving this process so quickly, and everything that you guys have done throughout this entire pandemic. City of McAllister has very closely followed your guidelines on phase 1, 2, and 3, and fortunately in Pittsburgh County we've had a very stable number of cases. I think we're down to just 3 actually active cases at this point in time, and I think 44 total throughout the entire process, and that's been a lot due to the leadership of the governor and his team. So to date, McAllister's faced the minimal number of COVID-19 cases. Since the virus first arrived in Oklahoma, the city of McAllister moved quickly to go to telework and to limit access to public service in a face-to-face manner by causing appointments to be made and shutting down City Hall to the public, however, keeping access to the public. And when our first case presented itself, it was in a nursing home, and as everyone's aware, that is a very dangerous place to have a case of COVID-19. And when this happened, the governor quickly called in the National Guard, and they came in and sanitized the facility and worked with the health department to conduct broader surveillance testing. In fact, we had mobile testing in McAllister because of the governor. The governor's leadership on COVID-19 and the expediency in delivering these critical federal funds has been essential to our success, most especially in the public safety area. We've had to make very expensive adjustments in this, and because when you're working from the federal government to the state government to municipal government, there's a lot of places in between there where things can get messed up, and fortunately that has not been the case once again due to the leadership from the state of Oklahoma. The city will continue to leverage reimbursement opportunities where necessary to enhance public health and safety in our efforts to continue to minimize the presence of this novel virus in our region. $1.25 million is going to go a long way to helping us especially in our public safety area, with the shutdowns that occurred and the oil and gas problems that we're having in the state. It doesn't get us back to even by any means, but it does give us a little bit to work with. Thank you for that. So I think I turn this over to the governor.
Thank you. Well, thanks again to all of the mayors and the county commissioners that have come up here and represent your constituents so well. We really, really appreciate what you're doing and your leadership. And Oklahomans have really done a really good job. So thank you for the compliments, but I want to give them right back to Oklahomans as well. If you remember, my original intent was always to protect the health and lives of Oklahomans first and foremost, and then it was to mitigate the impacts to Oklahoma's economy. The state of Oklahoma stands ready with all of our cities and counties. We want to help them move forward and get past this. And I want to remind Oklahomans specifically that COVID-19 is still in the United States. It's still in Oklahoma. So we have to remain vigilant. We are now 55 days into our safely reopening plan. And we have done a really good job, but we have to continue to protect our families. Our hospitalizations peaked at 560 back on March 30th. And right now we have under 200 people in the hospital across the state. And you've got to remember our original plan, we've done 25 different executive orders to slow the spread. And that was to build PPE, build hospital capacities, and make sure we flatten that curve. So I'm really proud of how Oklahomans have done that. And like one of the mayors was saying, everybody's worked from home. We've really separated and flattened the curve in our state. In the last 2 weeks, more than half of the cases have been people under 35 and under. So more than half the new positive cases have been in that age group because people are getting back out. Since this pandemic started, we've had 3,171 positive cases in that age group with just 6 deaths. That's 0.2% in that age group. I think the McAllister mayor said that there's, was it 1 active case or three active cases in Pittsburgh County. The state of Oklahoma has 1,500 active cases. That's something that's really important for Oklahomans to remember. We talk about the 9,000 or close to 9,000 positive cases, but there's currently 1,500 active cases in the state of Oklahoma. We have continued with our free testing sites. We have 88 free testing sites out across the state. We want to continue to remind people to get tested. If they want to get tested, you can call 211 to access that, find out where you can go to get tested. So with robust testing and the contact tracers, we have hundreds of contact tracers now that are going in and making sure that we are testing and we are letting folks know when they need to be quarantined as well. Right now we have massive amounts of PPE stockpiled in our strategic supply, so we're in really good shape there. We have stopped. We're just an opportunistic buyer now. We're not going out and acquiring more PPE. We're in really good shape there. Our hospital capacity is really good shape. We have over 4,600 hospital beds available to meet that demand. So Oklahomans, we remain well prepared. I'm still doing my COVID updates. I do these, I've moved them to now twice a week. But I'm making sure we're staying on top of all the data as we continue to move through this. So thank you for that, and with that I will open it up to a few questions.
Governor, the curve obviously isn't flattened anymore. I mean, the cases have been ticking up for the last couple of weeks now. Dr. Fry issued an advisory yesterday, and among the things that he's advising people to do is to be tested before they go and to wear a mask. Appropriate social distancing. I was wondering if you plan to get tested or wear a mask on Saturday at this rally.
So I will get tested. I'm actually going to be at the White House tomorrow. So I'll get tested tomorrow before I go to the White House. So yes, I will get tested. As far as wearing a mask, I haven't decided whether I'll wear a mask. I'll be introducing the president on Saturday, so I won't have a mask on at that point. But whether I have one in the seat, I haven't decided yet. And Colonel Fry's here if we needed to. I've got him here to answer some questions as well.
Governor, what you said Oklahomans were concerned about this week, especially as we're seeing record increases again today, just in the total number of cases, there's a lot of people who are really worried about the rally of this side. What do you say people were worried about?
Well, that's the great, I mean, we're a free society, and you're free to stay home, and I want people to protect their family. If they don't want to go to the rally, they shouldn't. There's over 1 million requests right now to go to the rally. It's really unprecedented how many folks have requested tickets. So there's a lot of folks that want to be there, want to support the president, but of course you need to make the best decision for your family. The purpose, we have COVID in Oklahoma, and we have to learn how we're going to deal with that. And so that's washing our hands, that's being very safe. If you're immune compromised, like I've said from the very beginning, we've asked those folks to kind of stay at home more. And again, we have under 200 folks in the hospital at this point. It's here, but that was the reason we started doing all these executive orders to slow this spread down. It was never to get it to 0 cases. And so we're watching those cases very, very closely, but it's mostly around, the folks, that 35 age group are the ones that have gone up. Those asymptomatic, we're testing tons and tons more people. The good news is it's still a 3.8% positive test rate. So of every test we do, about 3.8% come back positive. But Oklahomans, we're going to have to learn how to deal with this and learn how to readjust how we live. We're excited to host the president here on Saturday.
Are you still planning to go to the Greenwood district this weekend?
I'm doing several deals with the African American community, and that's still kind of in flux. We believe, Senator Langford and I believe that Vice President Pence, we're going to have a great sit down with some leaders in the African American community to kind of listen and learn and talk. I don't know if the president is going to go to the Greenwood district now. It was a request that I made early, but because of the Juneteenth celebration with the Secret Service, it could be problematic to have the president go there because some things have to be disrupted and shut down for a presidential visit.
Governor, what's going to happen to the $2 million worth of hydroxychloroquine that the state bought earlier in the year?
I may have turned it to Colonel Fry, but I think that'll just go through our pharmacies. That drug is used for other purposes as well. That was a precaution that I was protecting. I wanted to make sure that I pulled out every stop to make sure that I got all of the equipment that we needed in Oklahoma, any drugs that I thought there was going to be a run on, to make sure that I protected the health and lives of Oklahomans, because that was my #1 goal at that point. And even the PPE, we didn't use all of it. We've got it in the stockpile, but I'm not going to apologize for being over-prepared for Oklahomans.
Governor, the online checkbook with details for CARES Act spending, it just has summaries right now. You can't dive into that section specifically. Is there any change to that that's expected?
So you said the online checkbook?
Doesn't have details, just got summary totals.
Yes,
working on expanding that here in the next couple of weeks. We just had a meeting with the developer yesterday. Due to it being a reimbursement process versus a direct purchase, the way in which we load data is different. But the full intention is to meet the governor's goal of transparency, and we're working with the developer to accomplish that.
Are you currently in violation of the law because it's not done? That would fill out an emergency on it?
It is done, and since the numbers are all posted and transparent, we are in compliance with the law, and we intend to take it a step further and ensure that all the data is available. In the meantime, we are also fulfilling your request to get those spreadsheets out as well, so please don't hesitate to ask.
What do you think you'll have a decision on Greenwood for Greenwood District?
Well, that's something that it'll ultimately be the president's decision. I mean, ultimately the president doesn't ask for permission before he comes different places. We found out that the president was coming, and so we're gonna make sure it's the best and we're as safe as possible. But whether he goes to the Greenwood District, that's something that the Senator Langford and I have now recommended that he not make that visit over there, just because of the disruption to the celebration on June 19th, the day before, that would be disrupted a little bit with the Secret Service. However, we're trying to get Vice President Pence to have a sit down. So I believe he's going to come in on Saturday, and we should be able to have some great discussions with him. So we're looking forward to that.
We'll get into details on that as soon as they're firmed up. They're not yet.
This route is probably going to be the largest indoor event that the country has seen since all of this started. Is this really the right time to come to Tulsa? Health officials say that they don't think this is the right time. Is this really the right time? And even the Tulsa president, he asked you, should I come to Tulsa on Saturday? Do you tell him, no, I don't think so? Or you say, yeah, you're right.
No, I told the president he is absolutely welcome to come to Oklahoma anytime he wants. We think we're one of the first states that has successfully gone to phase 3. And I'll let Colonel who's over the health department kind of speak to the readiness of our state to have the president here. Colonel?
Sure. Thank you, Governor. So we, by walking through the surge plan that was developed and the, increasing our PPE, and we were actually had an incredible response in the state of Oklahoma. When you look at the states surrounding us even, we've had much greater response. So we were able to lower the overall numbers and delay the surge to the point to allow us really to prepare for our healthcare capabilities, increase our capabilities within state. We've increased testing capability. We've increased our hospital surges up to at least 40%, and then we have 2 additional flex plans above that, which we have not had to use any of those pieces of that additional staffing as of yet. Overall, our hospitalizations in the state are still very low. I think there were 181 as of yesterday. Those numbers don't come out until later in the day today to know what they are today. And so we've done extremely well with this. So overall, our state is very well prepared if you look at our state compared to the rest of the nation.
Do you think this rally is a good idea?
It's not my place to say whether I think a rally is a good idea or not. All I get to do is give you the public health meeting of follow the CDC guidelines and try to keep yourself safe. And if you're one of the most vulnerable populations, as the governor said, then it's better to watch that from home.
So essentially, you're already saying that even if there is a surge from the rally, that the state is prepared to deal with that?
Absolutely.
The health department recommending people get tested as a baseline before the rally. Is there a capability on county health departments and the state to run all these tests A before people go and B just to, test tens of thousands of people?
We have the capability of testing over tens of thousands of people, yes. Now on a daily basis, I think we're doing about around 6,000 tests at this time. So that we do have the ability to increase that, not only on in-state capability, but we have some contracts with out-of-state companies as well.
Last 7 days, steady increase in positive tests, set records through the last 5 days for new positive tests. Is there a plan in place to ever scale back some of the reopening? I guess that's a question for the governor as well, but from your standpoint, is there a point where you go to him and say, we're too hot right now, we've got to scale back?
I don't think that's a part of the plan in the governor's plan. I know that the gating criteria for reopening was just that, it was for reopening. It was once you had achieved that those numbers for at least 14 days, then you were able to consider reopening. So we went through that, and once you reopen, we are expecting an increase in numbers, quite frankly, because as people get out and they move around more, as businesses open up, you're going to have more increased contact, and you are going to have increase in numbers.
The hospitalizations usually lag these cases by a couple of weeks sometimes. Are you afraid what's happening in Texas could happen here, where you just all of a sudden have a huge surge in hospitalizations?
We watch those numbers daily, and of course, we are always watching and concerned about what's going on. We don't want to have any cases in the state of Oklahoma. Unfortunately, this is probably a new normal for us. This is what we're going to have to live with. But yes, we watch those. It's interesting. I've engaged some conversations with some research people around the country trying to understand why our surge plan, why we had such a great response in Oklahoma. We had a better response than even surrounding states did in our region. So you can't really predict based off of what's going on in Texas is what's going to go on in Oklahoma.
Commissioner, could I just ask you real quickly, what State Department of Health staff or other state officials, or are you helping the county folks, will be at the rally? I'm not clear who's checking people in and who's doing temperatures. Is that the responsibility of the campaign? Will you be there Saturday? What can you tell me about the response of public health officials?
I am respectfully not going to be there. I am going to be working with all the other hardworking public health people around the state and the healthcare workers around the state to try to make sure that everyone stays as healthy as possible. I'm not sure the details on who's actually checking the temperature, and I believe that that's the staff of the event center, but I'm not sure who's doing that.
Is that something you feel like you should know as Commissioner of Health?
Well, anyone can check temperatures and ask people to wear masks and pass them out. I don't think that that's doesn't really require a higher standard of knowledge, and we've been assured that that's going to happen.
Governor, you had mentioned at one point looking for an outdoor venue. Have you had any luck finding that, or an overflow arena?
You know, we didn't. We've decided to stay where we're at. That was one of the things on the table, was to look for an outdoor venue. It didn't work out in the city of Tulsa, but you know, we're moving forward with where it's at, and we're going to make the absolute best out of it. And before I forget, Wagner County Commissioner James Hanning came in the back of the room, so thanks for joining us. Appreciate you.
There's not going to be an overflow site, Governor?
There is going to be an overflow site. I think it's at the convention center. Is that right? So there's going to be about 6,000 or 8,000 folks there, and I think the president's
anything on that government campaign that hasn't been. We're not involved in that. Thanks, everybody.
Thank you all.